Welcome. So glad you're here. Now, each day in practice, I help patients just like you who are dealing with the overwhelming, life-altering challenges of a cancer diagnosis. So I don't have to guess to know how overwhelmed you're feeling right now. Overwhelmed by all the information from your family, from your friends, from the doctors, from your endless internet searches. Some of the questions that I field most often include things like, what can I do to prolong my life? Or what can I do to reduce the horrible side effects associated with cancer treatments such as chemotherapy or radiation? Or what can I do to support my immune system? Now, clearly, if you're here watching this, you're interested in improving your odds, in being an active participant in your fight against cancer. And I congratulate you on this. Being an active participant in your own health is a critical component to your healing. There's no question that a cancer diagnosis carries a lot of fear. But it seems that many that work in conventional oncology are only compounding this fear. It's so common for patients to be too afraid to even explore supportive cancer therapies that would help them because of the fear-based messaging from their oncologist. These reasons are not based on science, but on ignorance and bias. And many cancer patients think, look, if I don't do what they say, the outcome will not be what I hoped. This misinformation is shameful, really. The truth is there's so much you can do to help improve your odds, and I've created some resources to help you navigate through this in the most effective way. I'd like to introduce myself. My name is Dr. Steve Rallis. I am a dual licensed doctor of both chiropractic and naturopathic medicine, and adjunct faculty at Trinity Medical School in integrative medicine. Now, my clinical focus and research is actually on integrative oncology and in providing supportive cancer care every day to individuals just like yourself. In 2024, we celebrated our 25th year in practice. In that time, I've realized that while I can't help everyone, I can certainly share what I've learned along the way, share the strategies and the information that will make the biggest difference. And in that spirit, I recorded a 1-hour masterclass consultation called Got Cancer? Start Here. Now, the idea behind this video conversation was actually very simple, and it was inspired by a friend who asked, look, if you're sitting down with someone struggling with cancer, whether it's new diagnosis or a recurrence, what would you tell them? And I gave this a lot of thought. Would I talk about supplements or nutritional strategies that target cancerous metabolic disease? Would I discuss potential off-label drugs that can help starve cancer's fuel supply? The list of potential therapeutics in support of cancer or integrative oncology is almost endless. But at the end of this contemplation, I said, I would pretend that they're actually sitting across from me as my patient here in my office, and this is what I would say, hence the title, Got Cancer? Start Here. Now, the key in cancer care is to implement the most effective supportive strategies right away. Then you can build on these strategies. Now, in this 1-hour masterclass, I share these. In terms of supportive cancer care, it's no question, this is where I would start. I also recently wrote a book titled When Oranges Become Apples, What Your Oncologist Won't Tell You About IV Vitamin C in Cancer. Now, this book is based upon my clinical work and my published research using high-dose IV vitamin C in cancer patients. The book was written as a response and as a resource for patients looking to better understand the science that supports integrative therapies that are not only supportive, but synergistic to the standard of care. In this book, I discuss how vitamin C, when administered intravenously at high doses, changes its nature from a potent antioxidant to a powerful anti-cancer therapy. I explain in detail how IV vitamin C can enhance the effectiveness of chemotherapy or radiation while reducing its toxicity. I also discuss how to create comprehensive treatment plans that will help disable cancer's metabolic machinery, which lab tests are required to ensure safety, and how to best assess progress and improvement in your cancer journey. It's my sincerest and most humble hope that the information that I share will help give you some clarity and give you some direction on what you can do today to improve your odds and assist you on your journey.